Imagine all of the patients and their families all over the planet who are seeing their physicians right now. Some of them are sicker than others, but all of them share one thing: an experience. Improving healthcare starts by improving these experiences through communication and through education. And that's where you come in, the Patient Family Advisor. By sharing your experience and the experience of your family, you can change a lot.
As physicians, we think we know a lot about the treatment of cancer, and I think from the scientific standpoint, we do know a lot about how to try and cure cancer. And the more I've learned from the patient advisors, the more I realize we really just haven't even scratched the surface about how to treat the cancer patient in general.
They don't know what it's like to be a patient, to hear that news. Their perspective is so different. You know, the hospital for them is a very normal place. It's life as usual. It's going to work. Patients walk in the hospital and their blood pressure rises. It's very different, and sometimes it's very scary.
Patient Family Advisors help to put the power back in the hands of patients and their families.
So the Patient Engaged Research Center has 4 types of advisors currently. We have e-advisors, where you are part of a virtual community called Insights Community. Insights Community is run within Henry Ford, and once a month to once every 2 months, you get a survey. After you fill out those questions, if you're eligible, and you're automatically put into a sweepstakes for an iPad or a sum of money. The second type of advisor is our focus group advisor. Those advisors participate in focus groups. So whenever we have a topic that we'd like to get some feedback on, I go into the pool of focus group participants and I get whoever's interested and they come and participate. The third type of advisor is our research project advisor, and they participate as active partners in the research that we're doing here in the Patient Engaged Research Center. And then the last type of advisor that we have, and this is our largest group of advisors, are Henry Ford Health System advisors. And they serve on councils, committees, projects, service excellence teams, quality improvement projects around the system.
We need you to help shape the future of healthcare. Being a Patient Family Advisor gives us the feedback that we need to improve medicine.
I learned a ton from them every single time we meet. They inspire me to do better, and even though the meeting may have ended, a lot of the conversations linger, and I come up with ideas based upon our conversations with the patients all the time.
That was the importance of joining this advisory meeting for me, is to share what worked for me may work for somebody else.
Well, it gives me the opportunity to have a say on what's going to happen in the future for other women. It gives me the opportunity to try to make things better for them so their outcomes are better.
We meet once a month, usually for an hour and a half. Just ask that I express my opinions, my feelings, and make a contribution to the group.
We need you to help us make this change. And because you'll be joining thousands of other advisors, the commitment is less than a couple hours a month. Become a Patient Family Advisor by going to henryford.com/patient advisor and click on the button for an online application.